Hey, good evening, everybody. Dr. Nathan Thompson here with Exemplify Health Center, an affiliate of the Wellness Way. Appreciate you guys joining me live. I know I'm doing a little bit unannounced. I was planning on doing it Saturday morning, but we had some other things that got in the way, some wonderful blessings that got in the way. So my wife went into labor on Friday night, and we had a beautiful baby that was born on early Saturday morning. So I appreciate, guys, all the well wishes. I appreciate all of the wonderful comments. So it's been kind of a whirlwind of a weekend, taking some time off in order to spend family. But I did come in order to do this live video for you. I was itching to do it, and also I got permission from my wife. So if you guys are watching right now, please do me a favor and just let me know where you guys are watching from. Make sure that you say hello. If you can hear me okay, make sure you also let me know if you can hear me okay. I would appreciate that. So for those of you who were wondering, here is a picture of our baby. So a brand new baby, our fourth child. His name is Elias Sheldon Thompson. And there's a meaning behind all of that, only because Elias, also known as Elijah, was a warrior in the Old Testament. And one of the things that I have always been is a person who always wants to stand up. And I want to teach my kids to stand up for what is right, not for what is easy, to always do the right thing. And if you go back and you look in the Bible, about the story of Elijah, you can see someone who stood up under enormous pressure from society. And so that's what we want to teach. And I think it's fitting for the time that we're living in right now. And also his middle name, Sheldon, in order to honor his grandfather. And so it's just one way that we want to further the legacy, obviously, of our family. So little Elias and my wife, his mother, were able to go home today. And Elias was born 9 pounds, 3 ounces. So he was also a large baby. That is my fault. I come from a family of large Norwegians. All right. So it's my fault with that. And I have apologized to my wife 4 times because we have had 2 9-pound babies, a 10-pound baby, and also an 11-pound baby. All right. So guys, before we get into the GI, the gastrointestinal system, part 1, guys, coming up on Thursday at 6:00 p.m. Central Standard Time at Exemplify Health Center, our office here in Yorkville, Illinois. Get registered for that. We are still taking some registrations. I see that they're still coming in for the approach to inflammation, guys. And whatever it is that chronic inflammation is literally the spark that leads to every single degenerative illness out there. Yes, that includes the gastrointestinal system, but even weight loss resistance, cancer, infertility, thyroid issues, arthritis, joint issues, type 2 diabetes, autoimmune issues, issues with the hormones, and whether they're the thyroid, whether they are even brain hormones, neurotransmitters, or whether they are gastrointestinal hormones, or whether they're fertility hormones. Guys, all of this is related to inflammation. And one of the things I'm going to talk about is I'm going to talk about specifically the gastrointestinal system and how inflammation affects the gastrointestinal system. Guys, one of the reasons why the gastrointestinal system is so important is because, guys, when they say your gut is your immune system, they're not 100% right, but I can see where they're going with it. And the reason why is, guys, when you talk about the immune system, just think the immune system puts the soldiers at the barrier where they're going to come into contact from external environment into internal environment. Okay. So where does the immune system want to fight the battle? It wants to fight the battle at the border, wants to fight the battle at the castle wall. It doesn't want to wait until it's inundated with foreign proteins, infections, whether it's a bacteria, whether it's a virus, whether it's a food, whether it's a toxin. It wants to handle it where it meets the external environment to the internal environment. And so that's why you do have so many immune cells that are sitting around the gastrointestinal barrier. And that's why, guys, when it comes to inflammation, why the GI system is in fact so important. So guys, all you have to do, if you go to the top of the page, if you're from the Yorkville area, Chicagoland area, go to the top of the page on Exemplify Health Center or on Dr. Nathan Thompson. If you're watching on Instagram, you can also just go to our link tree, go to the top, and then you'll be able to see upcoming events, and you'll be able to follow a link in order to register on Eventbrite for the Inflammation Talk, which is going to be in 3 days. So it is coming up very, very quickly. All right. So as we get into the gastrointestinal system and looking at it from a different approach, guys, here is just what is so amazing, because anybody who says that the science is settled, please run away from that person. And I'll give you a perfect example. In the last 3 years, you can see how the experts, how unbelievably wrong they were. They were completely wrong on so many things, but we still follow them because they're considered the expert. Okay. And actually, if you just see, and I believe this came from, and I don't know the journal that it comes from, but I know that it comes out of Great Britain, I believe. And they had just had said how natural immunity, again, is better than artificial immunity, if you know what I'm talking about. And then also they just released some statistics from New Zealand from, I believe it's 2022. And again, they actually saw the death rate from COVID was increased or was higher in people who had the thing versus people who had quote unquote natural immunity. Okay. So when everybody says the science is settled, or listen to me because I am the expert, guys, science is never settled. Not only that, is when someone says, I believe in science, you shouldn't have to believe in science. But when you look at our environment today, the new religion is actually called scientism, meaning I don't believe in God. I just believe in science and science only. And it just makes me laugh because I'm like, well, where do we come from? You really think that we crawled out of a pool of amino acids that lightning struck that started the first cell, and then we crawled out of the ocean as a cow and developed? Yeah. You know where I'm going with this. So regardless of where you stand, if there's just a level of belief that is actually required. And when you look at these, and you look at the complexity of this, and basically this is a diagram of all of the biochemical pathways that take place inside the body. Okay. We're going to start here right where you see the red, and then in about 8 hours, we're going to end up at the very bottom right of it. Okay. Now, these are all the biochemical pathways that take place inside the body. And here's the thing. This is what we know. This is what we know. And there's a lot that we don't know. I'll give you guys a perfect example. If you look at how a muscle contracts, that is called the sliding filament theory. Let me say that again. It's called the sliding filament theory on muscle contraction. It's not even a law as far as what scientists know how a muscle contracts. So anybody that says we know everything about everything and the science is settled, it never is. So that's why you have to come from the standpoint, which is how we're able to solve problems that other people can't, because we're coming from the perspective that maybe the body isn't stupid. Maybe the body isn't messing up. Maybe the body was actually created not to mess up. It was created to adapt and created to survive. And that maybe a lot of illness isn't actually an illness as much as it's an injury. And that injury is the body trying to adapt, and that you need to start looking at things not as some kind of illness with no hope, but look at it as an illness and say, or an injury, and saying, what am I doing to injure this area and keep causing that injury? And this is 100% true when you come with the gastrointestinal system. Okay. So you have to come from the realization that you're going to say that the body is stupid and the body messes up, or you're going to say, maybe the body doesn't make mistakes. See, if you come from this perspective, maybe the body doesn't make mistakes, then you can start solving your problems from a different perspective. And the reason why I want to go over the gastrointestinal system, and I'll give you a little bit of some of my background, because one of the things I have always asked is the question why, and I was never, ever given a clear explanation. Maybe you actually go to your doctor and you say, why am I having this? Hey, doc, why do I have hypothyroidism? Why do I have an autoimmune disease? Why do I have allergies? Why do I have asthma? Why do I have swollen tonsils all the time? And usually the answer is, well, it's just, genetic. Your parents had it. or, maybe it's just some bad luck. There's really just nothing that you can do. And again, if you keep thinking that, well, it's just genetic, then it's going to make you hopeless and also extremely lazy because there's nothing that you can do in order to change. Why would you change if it wasn't up to you? And why would you have any hope? Because it's just based on some kind of, genetic mutation. You were given some kind of bad hand. And when you look at, that, maybe your genes are actually changing according to the environment. So this is me, guys, growing up. So I was on asthma medications by the time that I was 4 years of age. I was on allergy meds by the time that I was 6 years of age. I developed severe tinnitus. I had to go to a hearing specialist who said, yeah, I mean, he's got terrible tinnitus. There's really nothing that you can do. It's just, I guess it's genetic. I was on so many allergy medications that I spent probably a third of my life feeling drowsy because I was on antihistamines. And remember, histamines excite the brain. Antihistamines lower that and will make you drowsy. So a lot of asthma medications. And I said, hey, why am I on asthma medications? Well, because, someone in your family has it. And how long do I need to be on these asthma medications for? And it was probably for the rest of your life. Just as an FYI, I haven't been on asthma medications since I was 22 years of age. So I haven't been on any. So don't let anybody tell you that you need to be on this for the rest of your life, because I threw those things away. I haven't taken asthma meds. I haven't taken allergy meds, now for 20 some years. I was on a lot of rounds of antibiotics, having problems with strep throat. I was having problems with ear infection. So I always went on a lot of rounds of antibiotics. I started to develop a lot of joint pain by the time I was 14, 15 years of age. So I would take a lot of NSAIDs, so I'd play sports on a lot of NSAIDs, probably would take 600 to 800 milligrams of ibuprofen even before a practice. And then, by the time that I was 14 or 15 years of age, largely due to the amount of antibiotics I was on growing up, if you know what the antibiotics do to the gastrointestinal system, I developed what was known as irritable bowel syndrome. So by the time that I was in high school, I would have diarrhea after every single meal that I ate. And you talk about something that's just absolutely embarrassing. But not only that, but it's just, it would always come at the wrong times. There was times I was like, I don't even want to go anywhere and eat because of what's going to happen next. In fact, it got so bad that I would take anti-diarrheal medication prophylactically just to prevent myself from having diarrhea, especially when I would have to go to school. I also, my tonsils were removed and my adenoids were removed at 21 years of age, if you can imagine that. So they had gotten so chronically infected that they developed scarring on there, and literally in these scars, deep pitted scars, would just harbor bacteria all the time. Now, if you look at me to the right, this is when I was 18 years of age. You would look at me and say, wow, he's pretty healthy kid. But look deeper and you can see in no way, shape, or form was I actually healthy. And that's why we think, oh, well, he exercises a lot, so he must be healthy. Guys, that's not the definition of health. If you are suffering a health problem, you don't need to necessarily sleep more and eat some kale and take a nap and run a 5K. What you need is to first stop causing what is creating the inflammation inside of the body. So here I had all of these problems. I always wanted to ask the question, why? And that's what we're not asking. We're not asking, why on earth is this happening? Or if we get to the next level and we say, I'm going to ask the question, I'm going to ask my doctor why. And it usually is just a really bad, intellectually lazy answer of just saying, it's just genetic. It's just one of those things. Or they'll say, well, maybe it's environmental, or maybe it's just something that we don't know yet. But then when you go and you tell your doctor, well, what about this? You know what I'm talking about? And they'll say, oh, no. It's definitely not that. We don't know what it is, but it's definitely not that. And so that's why, guys, we need to get back to just becoming intellectually honest when it comes to helping people start to get better and start to heal. So here's some of the symptoms that you have poor gastrointestinal health. Number one is colic. Have you ever seen a colicky baby? We have all the time. I've never had a baby of mine that has had colic, but we have had babies who have come into our office suffering terrible colic. Okay. Actually, if you look at colic, you will see, the baby, and if you touch their abdomen, you will see that the abdomen is extremely bloated. You'll see it's rigid. It's very hard. And so there's a reason, guys, why there is colic. Okay. And when you look at the physiology of the body, you'll understand, wow, I guess this is just isn't a normal process. And guys, when you see what happens when what we do with babies with colic, they become a completely different baby. Okay. Because we understand the gastrointestinal system and what can cause gastrointestinal inflammation and bloating, which is going to cause tremendous amount of pain in a baby that's suffering with colic. Here's some other things: reflux. So acid reflux, if you get a lot of bloating when you are eating. So after you eat 2 to 3 hours and you're experiencing, the food belly, the food baby, that's a sign that the GI system's not doing very good. How about this one? Sinus congestion. So after you eat and you experience some kind of sinus congestion, this can actually be an allergy response, either IgG, IgE, or it also can be a problem when it comes to yeast or having a yeast overgrowth within the intestines. How about constipation or diarrhea? Or sometimes it's even both. Now, a lot of times people will say, Doc, what's worse, constipation or diarrhea? And I will always say it's constipation. Now, what about asthma? Okay, I want you to think of it. So remember where the immune system sits. It sits at the barriers, and inflammation that's taking place in the gastrointestinal system will also reflect itself in other barriers, which can be the lungs and ding, 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 the skin. Now it's starting to make a little bit of sense. How about joint pain? How about acne, eczema, psoriasis? How about even brain fog? How about poor sleep, depression, and anxiety? Because about 85 to 90% of your serotonin is made in the gastrointestinal system. It is not a brain hormone, it's a GI hormone, which maybe the brain is just an antenna for what's happening to neurotransmitter production in other parts of the body. How about thyroid issues? Yes, it can be thyroid issues. And the reason why is because the GI, some of that thyroid hormone is converted from T4 into T3, the active hormone that your cells are using. Or what even about the idea of adrenal fatigue? Doc, I have adrenal fatigue. Chances are you don't have adrenal fatigue. You have adrenal downregulation. And the reason why your adrenals are downregulated is because you're so doggone inflamed. Think about when you're sick. If you have the flu, you're not jumping around with all kinds of energy. So the number one symptom that people come in for help in my office has to do with fatigue. And everybody thinks it's their thyroid, or they think it's their adrenal glands. And yes, there can be one, it can be both. But many times it's not either one of them. It has to do with inflammation and how the body is adapting to those things. So listen, the reason why, guys, why so many people are suffering today, it has to do with them not understanding what we would call the Swiss watch principle. And the reason why is I want you to think about it is, let's say you start to develop some gastrointestinal issues. Well, you're going to go to your GP. GP is going to say, all right, I think this needs a little bit, maybe a different eye. Let's go to the specialist. And then you end up going to, a digestive system doctor, a gastroenterologist. And then what they're going to do is they're going to do an upper scope or maybe a lower scope. They're going to look at a 30,000 foot view, and they're going to say, yes, we definitely see some changes taking place in here. We're definitely seeing some inflammation take place. But I want you to think of this. The answer is always a med. It's always a medication. And many times when you're looking at some of these gastrointestinal issues, many times the answer is to do something in order to suppress an inflammatory response. And so let's say you have a gastrointestinal issue. You also develop a skin issue, and then you're going to go to the skin doctor. And then they're going to look at that and they're going to say, yes, we can see that your skin is inflamed. So we're going to put you on something, a topical corticosteroid that's going to knock out that immune response. If you see there's acne, we're going to give you synthetic vitamin A. And so what you do is you end up going to doctor, to doctor for many things that could be the same problem expressing in different areas where there are barriers. And so that's why, guys, when people say, oh, you can't talk about this, doctor, because you're not an expert in it. Well, guys, maybe, just maybe, you need to look at it from a whole body approach and quit devolving down into specialist after specialist and subspecialist, because in my opinion, a specialist is someone who knows more and more about less and less until finally they become an expert in nothing. All right. And that's why maybe if you step back and you said, let's look at the whole body as a whole, just like a Swiss watch, because if you open up the back of a Swiss watch, you will see all of these gears. And it's like looking at those gears and saying, hey, which one can I remove that, and the watch is still going to keep accurate time. And you understand you need all of those gears. And that's why all of these organ systems are working off one another. I'll give you a perfect example. Someone has an extreme problem with the digestive system. Yes, you will see a change in a person's endocrine system. You will see a change in your fertility hormones. You will see a change in your adrenal glands. You will see a change take place in through the thyroid. But then what happens is, rather than look at everything as a whole to see how things are starting to adapt, we just go around this whole entire circle, moving from specialist to specialist. And it's no wonder why so many people stay comfortably sick, because the cause is not going to be addressed. I'll give you a perfect example, okay? What you actually see here is you see an autoimmune panel that we run, not in every single person. We don't run every lab that we offer in our office on every person. Usually we'll see what are the biggest things that are driving these things down. Well, in this person, just based off of what was going on, previously diagnosed with Hashimoto's and also having some other issues, I said, hey, you know what? Maybe we should run just an autoimmune panel and see what's happening as far as maybe other autoimmune reactions taking place in the body. So you could see positive for thyroid peroxidase. You could also see, and this is just page 1 of it, but you could also see something that was very interesting. You could also see that there were auto antibodies to the gastric parietal cells. And you might be like, what on earth are your gastric parietal cells? Well, the parietal cells are in the stomach and they produce stomach acid. They produce stomach acid. What does stomach acid do? Stomach acid sterilizes your food, which means if you don't sterilize your food very well, then you can start to develop overgrowth in the gastrointestinal system because you're not killing off of that bacteria. But not only that, you'll actually be a lot more susceptible to getting food poisoning, for example, because you can't sterilize your food. But here's what's interesting. I don't know how many doctors have actually told you this, but you actually need stomach acid in order to be able to absorb, like B12, for example. You also need stomach acid in order to absorb iron. And this person was chronically had low iron levels and was chronically anemic. So would then megadose with iron, feel a little bit better. And then as soon as they would go off the iron, they would become anemic again. And because you need stomach acid to absorb iron, it doesn't matter how much you're trying to douse yourself with synthetic forms of iron, is that for her, you needed to calm down that reaction that was happening to her gastric parietal cells. But not only that, she needed a lot of stomach acid support in order to make sure that she can sterilize and that she can start to absorb those things and break down her proteins, and then make sure that she's being able to absorb iron even more. So that's when we talk about, it comes down to something that is a very easy concept, but you have to start looking at some complex things that can go wrong and how they start to work with the body. So here's what we do when it comes to our GI system when we start to have some kind of symptoms, especially in the initial stages. I was certainly guilty of this, obviously growing up. But basically what we do is we'll take things like Pepto-Bismol, Imodium AD, Tums for our acid reflux, Prevacid if it gets a little bit worse, or Nexium or Prilosec, for our acid reflux. And all those things do is it's like you have a fire and you just put the fire out, okay? And in fact, even if you watch like the Prilosec commercial, this was back, I think, 15, maybe 20 years ago. And in this commercial, they were bragging about how they put out the fire a lot sooner than the next leading brand. And you looked at this and you're like, oh, that's really cool. Look at them, argue on who can put the fire out better. And guys, that shouldn't be the goal, is who can put the fire out better. The goal should be, well, what's causing the fire in the first place? As yes, you could probably use this temporarily, but what happens if you fail to actually start to find the cause? And then when you look at some of these, what are known as proton pump inhibitors, and you can see that they're starting to come out, and this was probably 10, 15 years ago, they're saying, this is interesting. Maybe we shouldn't be recommending this for everybody because we're starting to run into some issues. So the first thing that can go wrong is actually in the stomach. When you look at acid reflux, it's not the fact that you're making too much acid, it's that you're not making enough acid. And it causes the stomach to keep turning this around for a long period of time to try to sterilize the food and break down the proteins. Every time it goes through another mixing cycle, you have a little sphincter called the pyloric sphincter, or actually the esophageal sphincter at the top of the stomach. That stays open, and if the stomach says mix it again, it will propulse itself up through, and that's when you can get acid to spill off in the esophagus and cause that type of burning. But when you look at reflux medications, they're not benign. They have side effects. So number one of the things that they realized was, all right, well, we're putting people at an increased fracture risk. As if you need any more reason, to be worried about osteoporosis and brittle bones. And the reason why is because low stomach acid, by decreasing it even more, you will then inhibit the absorption of, yes, iron, yes, B12, but other things like calcium as well. Why do you think that when you look at Tums, they add calcium to it? Isn't that interesting? You can also develop issues like pneumonia, because you can actually have some issues where this will come back up and not sterilize and can go down into the lungs and cause a bacterial infection. It can cause irritable bowel syndrome. It can cause a C. diff infection. The reason why is because you're not going to be sterilizing your food even more. And that's why when we look at C. diff, people are like, oh my gosh, I have a C. diff infection. I'm like, yeah, that's what happens when you don't sterilize your food well enough, okay? How about dementia? One of the reasons why is because it inhibits the release of acetylcholine at the stomach, and it inhibits the production of acetylcholine within the brain. And so that's why acetylcholine is a neurotransmitter, and this is why acetylcholine is actually needed in order to link neurons that are involved with memory. So now they're also seeing, hey, there is an issue when it comes to that, and even cardiac arrhythmias. Wow, interesting. Why? Because you're not absorbing your minerals the way that you are supposed to. Things like magnesium, calcium, potassium, all of these things that the heart needs in order to maintain rhythm. But not only that, what's also interesting is that it can increase your cardiovascular disease risk. And the reason why as well is because acetylcholine is also needed because remember, what opens and closes your arteries, what makes them expand and contract, it's nitric oxide, but that only happens with a nerve impulse around that, in which the neurotransmitter is acetylcholine. So just look at just one thing and looking at long-term use, and then looking at it as a Swiss watch principle, all of the problems that take place. And this is just being on something that we would consider relatively benign. And this is where a lot of people end up, is they say, well, I don't like that approach anymore. So now I'm just going to douse myself with all kinds of natural supplements. And guys, the supplement world gets a very bad name. And probably the reason why is because so many people look at a supplement as a natural drug. They're still taking it with that approach, saying, I don't want to take a drug, but instead I'm just going to use supplements and take it as a drug. So I'm still putting out the fire, but it's a little bit more natural water. And so this is why when people say, hey, ask people, what are you doing in order to improve your gastrointestinal health? They're like, well, I take probiotics. Yeah, I take some of that, and that hasn't worked. And then you say, well, I guess probiotics don't work. And guys, if you even look at probiotics and how many times I recommend them, you would think people would say you probably recommend them all the time. And the answer is no, a lot less than what you would think, because you can actually test the stool. And there's a lot of people who don't necessarily need a probiotic. What they have is an overgrowth of way too many bacteria. And in fact, some people who haven't taken a probiotic, you can see they can get overgrowth of lactobacillus. So yes, that can be a thing as well. Now, why do they decide that they're going to take a probiotic? Well, because the biggest natural health influencer in the world, Dr. Oz, told me to, or some other influencer said, oh my gosh, you got to try this probiotic. It is amazing. Okay. And just so you guys know, there is not one supplement that's going to completely change your life. It really isn't. Stop looking for the one supplement. Stop, waiting for the person to find something in the Amazon rainforest that's going to make you perfectly healthy and not have to take any kind of responsibility when it comes to healing yourself. So the biggest thing that I will tell you guys something is, because there's so many people who come in and they have been blasting themselves with 5, 10, 15. The record that I have is 38 supplements, and they were still sick. And so people would say, well, that's just proof that supplements don't work. And I said, well, that's just proof that we're not handling it in the right order. So don't hire the fire department. This happens so many times, guys. Don't hire the fire department to do a carpenter's job. Okay. And this is what we do when it comes to medicine. And people will say, well, do you use a medical doctor? I'm like, absolutely. If I need to fire out, I will use a medical doctor, because they are the best at doing that. They have the right tools. They have the right training. But quit using a medical system after the fire is out, because the fire department doesn't know how to rebuild the house. Don't hire the fire department to do a carpenter's job. And also, don't hire a carpenter to do a fire department's job. The fire department has the right tools and the training to put out a fire. And that's why if you ever came to me and you are in the middle of a heart attack and you said, Doc, what do I need to do? I would say, please go to the fire department. Please go to the emergency room, because whatever they need to do in order to put out the fire. We'll figure out why it happened and figure out how to rebuild the body afterwards. And that's why I can't stress enough, guys, that you need to stop looking at your health as some kind of do-it-yourself project. Okay. At some point, you need to say, all right, I need to find someone who can get me from Chicago to Los Angeles as quickly as possible. And when you do it yourself without a roadmap, you may get there, but you also may get there on accident. You also may get there, and instead of taking 4 hours, it may take you 4 years. And so that's why you have to know how to start, where you need to start from. So let's look at, guys, some of the biggest things that people are suffering from when it comes to the gastrointestinal system. Here's something that I suffered with for many, many years: irritable bowel syndrome. So I went back to the American Board of Gastroenterology. We went to the experts, and here's what the experts actually said. The exact cause of irritable bowel syndrome is unknown. How about ulcerative colitis? The way in which patients get ulcerative colitis is still poorly understood. American Board of Gastroenterology. How about Crohn's disease? Right now, the cause of Crohn's disease is not fully known from the American Board of Gastroenterology. How about diverticulosis and diverticulitis? No one knows for certain why diverticulosis develops. Again, the American Board of Gastroenterology. So here's the takeaway, guys, from the experts. We don't know the cause. We don't know what's causing it. Yes, we can help you manage your symptoms until that organ fails, and then we can always just remove the organ. And that's what the approach is. And you have no idea how many people who come in and they're having, I don't know, thyroid issues, or they're having fertility issues, or they're having digestive issues, they're having hormone issues, whatever it might be. And I always ask this question: hey, what is your doctor's plan moving forward? And you know what they say? There is no plan. There is no plan. Well, the plan is to keep suppressing symptoms, but it's never, ever, ever addressing the reason why. So we have to start looking at this a little bit differently. Remember when I first started off, I said, hey, we look at things as injuries and not illnesses. Because if something is an injury, then what that means is let's first stop injuring it. This is very important, because if someone says, well, obviously there's a lot of inflammation within the gastrointestinal system, and we're going to put you on some kind of steroid medication in order to lower the inflammatory response. Well, what happens when you go off of the steroids and it gets inflamed again? That means that, well, the cause hasn't been addressed and it's still being injured. So I want you guys to think of this. If you were walking at night and you couldn't see very well, and you're walking along your sidewalk and you fall and you skin your knee, then yes, it's going to get red, it's going to get swollen, it's going to get hot, it's going to be painful to touch. We will call that an inflammatory process. Acute inflammation is very good, and it's actually needed in order to resolve and bring about tissue healing. So in our society today, we actually think that acute inflammation is bad, and we do nothing when it comes to chronic inflammation. This is why when I have done videos, or I've done reels, and I've said, this is why I don't ice, because that inflammatory process, no matter how ugly that it gets, and yes, guys, there are exceptions, come on. But you talk about, if I sprained an ankle, I'm like, no, I'm not going to ice it. I'm actually going to move it as quickly as possible within reason. And I'm not going to ice it, because that inflammatory response is perfect and it's needed in order to bring about tissue healing. Will it look ugly? Yes. Will it look kind of disgusting? Yes. But that is exactly the response that is needed. So if you skin your knee, it's going to get red, it's going to get swollen, it's going to get hot. But the problem is let's say the next day you do the same exact thing again. You fall on the same exact spot, you hit the buckle in the sidewalk, and you reopen that knee. Let's say that you did that every day for the next year, and now you're concerned. You go to the doctor, he looks at your knee and says, yep, if this has been going on for a whole year, let me go to my diagnostic manual, and it looks like you have a case of chronic knee scabitis. And then you have a fancy name to it, and then everyone says, hallelujah, it's so good to have a diagnosis. And then you say, hey guys, I want you to know that I've been diagnosed with this devastating disease. It's called chronic knee scabitis. But he never asked this question. He never said, hey, why do you keep injuring it? Because if you came to me, I would look at this and say, hey, stop falling on your knee. Maybe you should take a different way when you're walking. Okay, watch the buckle. That's the first thing that we need to do, is we need to stop injuring it. So I have a question for you. If you see this and happen and it never is resolving, should you go on anti-inflammatories, or would it make a lot more sense to stop skinning your knee? I know which one makes a lot of sense. And so when they say the cause is not known, basically what it means is we have no idea, but we can treat the symptoms. And that's why, guys, if you look at inflammation, doctors realize that inflammation is a serious problem. We're looking for the cause, and doctors are looking to suppress it, or to suppress the effects of the inflammation or the chronic inflammation. So as I finish this up and I get into part 2 next week, so we want to give you a lot of background in regards to this. I want to show you guys, here's how the digestive system works. And this is why, if you ever really want to know how the body works, then invest $150, $180. I'm not for sure how much it costs, and start reading what's known as Guyton and Hall's Textbook of Medical Physiology, because you would be amazed at even how doctors, when I explain things from Guyton and Hall's Textbook of Medical Physiology, and they say, that's wrong because you're a chiropractor. And I say, well, I actually took it from your medical textbook of physiology. And they say, well, it's still, I don't know. So the truth is the truth, regardless of who's saying it. So if you look at the digestive system, because I want to get you guys thinking a little bit, maybe if I start doing this, I can start to improve my gastrointestinal system. Guys, the first thing for you to be able to break down your foods and absorb your nutrients is that you need to be in a state of rest and digest. And guys, if you look at your autonomic nerve system, automatic, meaning it's not under any kind of conscious thought, you don't have to think about it, is that your body is in this balance of rest and digest versus fight and flight, okay? Or fight or flight. I want you to think of rest and digest, ability to digest food, be able to sleep. Think of healing. And if you look at fight or flight, think of a bear that's chasing you. That could be real or it could be perceived. Now you're starting to get into, yes, can mental stress absolutely wreck your digestive system? The answer is yes. Can mental stress absolutely wreck your fertility hormones? The answer is yes. Can mental stress wreck the body? Can mental stress actually lead to blood sugar issues and cardiovascular disease? The answer is always yes. And that's why you have to address something mentally, physically, and chemically. Quit trying to fix things by chemically manipulating it when there could be a problem physically and also mentally as well. It would be no different than if you had a pebble in your shoe and that pebble was irritating your foot, and you go to the doctor saying, my foot hurts all the time every time I take a step on it. The doctor says, I'm going to give you anti-pebble medication. That will help with the pain. And I'm saying, hey, why don't you take your shoe off and remove the pebble, and then things will be a whole heck of a lot better. So guys, just even for you to be able to have normal digestion, you need to be into rest and digest. Rest and digest is actually controlled by the vagus nerve. Vagus is actually Latin for wanderer, and that's the nerve that exits the cranial skull and then goes into things like your heart, goes into your stomach, goes into your intestines, and it brings it into calmness and relaxation. So rest and digest versus fight or flight. So when you are in rest and digest, one of those things as you eat is that it makes its way into the stomach. And so when you go into the stomach and you're in rest and digest, then one of the things that's going to happen is the first thing that happens to your stomach is that the release of gastric acid, hydrochloric acid, will start to sterilize the food. So that's why you have a stomach that's there to be able to destroy any bacteria that you consumed while you were eating. The other thing that it does is the gastric acid starts to break down your proteins. Guys, this is very important because your small intestine is not supposed to see large proteins. It's supposed to see proteins broken down as amino acids. This is extremely, extremely important. So even if you think about it, if you have a low stomach acid situation, and this can be due to, well, you exercise all the time and then try to eat. This can also be a situation you have a high amount of mental stress. You may have some parietal cell damage or destruction that's taken place. The first thing that happens is you don't break your proteins down the way they're supposed to, and they will make their way as proteins and not amino acid to be absorbed by this small intestine. Here's what's interesting. Your immune system is there around the barrier of the small intestine, and it's there to identify proteins that don't belong there as foreign. So yes, it could be a bacteria. Yes, it could be a virus. It could be a toxin, but could it also be a food? That's something that I want you guys to think about. And then you also have the pancreas, which then further breaks down your carbs, breaks down your proteins, breaks down your fats. So that's why your pancreas releases it's an endocrine organ and it's an exocrine organ too. The endocrine part of it is it's releasing things involved with your blood sugar, okay, like insulin, for example. But it's also an exocrine organ because it will secrete digestive enzymes. Those digestive enzymes are there to help you break down your fats, your proteins further, and your carbohydrates. Guys, this is why even if you look at, there are certain foods that are considered trypsin inhibitors, which inhibit the release of the digestive enzyme trypsin, which will interfere with your ability to break down proteins. Guys, and you have hormones that are based off of proteins, like a lot of your neurochemicals and your thyroid hormones. So then you have your pancreas. This is why that someone who has pancreatitis, one of the things that happens is that common bile duct can get backed up, and then the body secretes those enzymes. They don't have anywhere to go, and so they're secreted, and then they start breaking down the pancreas, producing an inflammatory reaction. Then you have the liver, which then produces and then stores the bile in the gallbladder. And so based on how much fat you're consuming, it will release a hormone known as cholecystokinin that then tells that the gallbladder, here's how much bile I want you to release, which makes it really, really hard when you don't have a gallbladder. That's why so many people have issues after they get their gallbladder removed. It doesn't mean that maybe you didn't need the gallbladder removed, but there's other things that you need to do if you've had your gallbladder removed to make sure you don't run into other issues further down the gastrointestinal system downstream. So small intestine, 6 feet of it, that is where absorption is taking place. And so you have a barrier within that small intestine. Your skin barrier is about this big, or this many layers, but your GI barrier is only 1 layer. And this is why barrier function in the small intestine is so important. It's not an impenetrable barrier, but there's certain things that you eat that will open up those barriers, like gluten, for example. So then absorption takes place. And then when you get to the large intestine, this is where it will start to concentrate into feces. You'll get water absorption, reabsorption. You'll get actually some bile acid reabsorption. And this is also where the microbiome will synthesize vitamins, make short-chain fatty acids involved in blood sugar regulation. And then you have elimination take place finally. Okay. So here's one thing that you can do before I see you guys next week is go check your poop. So check your poop. In fact, this is one of the questions that I'll ask people a lot of times, especially when we start following up, is because, and I'll say, hey, how's your bowel movements? And they'll say, wow, I guess they are getting good. I've never noticed this. I said, well, start checking your bowel movements and start checking to see what happens when you're having a bowel movement. One of the first things that you can ask is, hey, does your poop float or does it sink? Because if it's floating, there's going to be a higher fat content within that poop. And that means you may be having some problems with your gallbladder. Okay. You're not releasing enough bile, or you're not absorbing fats the way you're supposed to, I should say. So if you don't absorb your fats and they travel down and end up in the stool, they're going to tend to float and not sink. And you can even measure this on a stool test, how much like undigested fat you have in the stool. And that can mean that maybe I'm having a problem with the gallbladder. Even how many times should you be having a bowel movement? And you should have at least 1 a day. But really, ideally, when the body is working on all cylinders, you really should have a bowel movement after you eat any kind of substantial meal. And then look at your poop and you can say, well, what is the consistency of it? So you guys can go and you can find this online. It's a Bristol stool chart. And when you look at that, I will tell you this: type 1, which is separate hard lumps that are like nuts and they're very hard to pass. This is the worst one. So when they say, Dr. Nate, would you rather be constipated or would you rather have diarrhea? I said, actually, diarrhea would be better. So you will see that are lumpy like nuts, hard to pass. This is one of the worst things they can do. And then you have sausage shaped but lumpy, still hard to pass. or like a sausage with cracks on the surface, like a sausage or a snake. And then it starts to get softer and softer, in which it's watery with no solid pieces. Okay. Now, what on earth happens when you have diarrhea, for example? Well, if you think of throwing up, you think of diarrhea, you think of fever. It's the body trying to eliminate things. So, yes, when say I have diarrhea all the time, well, the first thing that I would say is well, look at the barrier function taking place in the small intestine, because if the body looks at something that it doesn't like anymore, it will say, send it through. We're not going to deal with this. Send this through. And that's what happens, especially if you have some issue in which you have an increased bacterial load taking place in the small intestine. The body will say, send this thing through. This is a poison. We don't want this. We're not going to absorb this. So when people say, or they ask me, well, what's type of stool is going to be preferred? It should be number 4. So it should be like a sausage or a snake, and it should be smooth and soft, and you should have no problems passing it. And also, it shouldn't require you to have to wipe a lot. So that would be number 4. So you can even start to see that, when we start asking people, especially they're having a lot of digestive issues, so that we don't have to keep testing them every single month. But when you start to see that their bowel movements get better, that their bowel movements become more regulated, that the consistency of their stool starts to get better, then we know that the body is responding well to that. Why? Because the body doesn't make mistakes. And so it goes back to normal, and it means, hey, we're doing something really cool here. You're not falling on your knee producing a scab anymore. And so that's why even looking at your stool can make a huge, huge difference. Okay. So guys, that's part 1. I hope you enjoyed that. I wanted to give you guys a lot of background when it comes to that, but we'll do a part 2 and go into it a little bit more about as far as how you test and some of the things you can do in order to improve gastrointestinal health. And so if you are still watching this, I appreciate that. And if you are from the Chicagoland area, this Thursday coming up, I don't even know the date anymore. It's this Thursday at 6:00 p.m. at Exemplify Health Center right here in Yorkville, Illinois. And you say, hey, I want to work with you, doc, and I want to get to the bottom of why I'm having all of these different issues. Please make sure you go to the top of the page if you're on Facebook, and you'll see it pinned at the top of the page to be able to register for that event on Eventbrite. Please do that. You have a couple of days before we close registration. And we cover inflammation, guys, and whether it's gastrointestinal issues or thyroid issues, or whether it's autoimmune issues, whatever it might be, the first approach that you need to start taking is inflammation, guys. And if you realize that inflammation is really the reason why you feel bad, then you'll understand that that's the first thing that you have to get under control before you start rebuilding the body. So many times people will rebuild the body, but they're still inflamed. And that's why a lot of people are still walking around with chronic scabitis on their knee, if you know what I'm talking about. So guys, you can go to the top of the page and get registered for that. And then coming up next week, next Monday, we'll do part 2. So guys, as always, I appreciate you watching. I appreciate you being on live. Make sure that you please share this video with other people. Make sure also, if you don't, make sure you like our page on Facebook, like or follow us on Instagram as well. And then we'll also be posting this to YouTube and also on Rumble. So you can go back and catch that, because a lot of people don't have Facebook anymore with a good reason. But they can watch the video that we'll upload in a couple of days to YouTube or Rumble. So guys, I appreciate you guys being on. I am going back in order to take care of our new addition to our family. And then as always, we'll see you guys next week. So be well, be blessed. Remember who you are.